Thank you to all of our Birmingham Area Coalition members for joining in on this presentation, which is a repeat of the presentation that was delivered at our last coalition meeting, which was on April 9th. And what we wanted to do is make sure that we provided to you all of the conceptual framework for how we'll go about developing this community action plan that we've talked about. Over the last few meetings, we've talked about some potential policy change focus areas and how we'll, go from that focus area to developing a policy scan to developing a community action plan. But we really wanted to provide some information to help you truly understand what that framework was. And so this presentation really does just kind of gives you an overview of what that community action planning process will look like over the next few months. So again, we talked about some potential policy change focus areas over the last couple of meetings. And so in order to get everyone caught up and on the same page, we'll just quickly go through some of those potential policy change focus areas. The very first one that we'll cover on this slide is comprehensive school wellness policies. And so when we think about comprehensive school wellness policies, we're thinking about looking at how we develop model school wellness policies that school districts locally can adopt. And so when we think about what goes into a school health policy or a school wellness policy, those could be things from what do we do with students when they're caught smoking on campus? How do we ensure that our cafeterias are sourcing locally grown produce? Are there some opportunities for us to change the offerings that are in the vending machine or take the vending machines out altogether? Are there opportunities for us to ensure that our students as well as our staff receive the recommended number of minutes of physical activity during the school day? So, comprehensive school wellness can encompass all of those things, or we can focus on maybe one key area of a school wellness policy. Those are decisions that we can make later on, but for right now, we're considering this notion of comprehensive school wellness as one of the policy considerations that our coalition can tackle. The second topic that has come up over the past couple of meetings has been transportation policy. So we've talked about things like implementing policies as it relates to ensuring safe pedestrian and bicyclist traffic, ensuring that we have bus transit available to our residents. We haven't talked so much about light rail, but we have talked a little bit about how maybe we can do a better job of educating motorists on how to share the road. We've also talked about things like changes to the built environment, whether that's increasing the number of miles of sidewalk within a municipality, or we've talked also about potentially the development of trails, walking trails within the community. So those are all things that could be considered when we think about this broader topic of comprehensive transportation policy. So that's another thing that should be considered by the coalition. We've also talked about how we improve information sharing within our community. And so most of our conversations have centered around the 211 system, which is something that is used in other states across the country to ensure that community residents have access to information, particularly social services type information within their local community. And currently we don't have such a system. We have 311 and some other information referral systems, but not necessarily the national 211 program. But our coalition members have expressed at different meetings that information sharing here in our local community is such a significant problem that it is worth us considering focusing some of our policy change efforts on. So that is another one of our considerations. The fourth consideration is how we educate the community on tax policies. And keep in mind that, the work that we're doing here with the coalition is federally funded. So with that comes the limitation of us being federally funded. And one of those limitations is that we aren't able to lobby. And so tax policies is just one of those areas where we want to be cautious that we're not lobbying. But what we've done is, or what our community coalition members have recommended, is that we see if there's a way for us to do a better job of communicating to our community members the benefits of changing how tax revenues are used, or if there are some opportunities to reduce taxes in some areas and increase taxes in other areas in an effort to improve health. So these 4 items, sugar, sweetened beverage taxes, tobacco taxes, taxes on groceries, and state tax rebates, all came up during past coalition meetings for consideration by the larger group. We've also talked about maybe looking at improving safety policies within our local community. So that could be safety policies as it relates to safe housing, particularly around affordable housing developments in our community, or we can focus on overall crime reduction in the community. But safety, kind of bubbled to the top as one of those issues that really was pressing, that we should be focusing maybe some of our attention toward with the work of this coalition. And so that is something else to keep in mind. The next policy consideration has been comprehensive economic development policies. And from the last meeting, it seemed that there was more of a focus on how we address employment. And when we talk about employment, we mean more specifically workforce readiness and helping people learn a trade so that they can be a more productive citizen within the local community and contribute to the economic stability of our community. So that was highlighted as an area of interest at the last meeting. Finally, we've talked about enhancing housing policies. In particular, there has been a lot of conversation about what we do in terms of affordable housing, how we can eliminate blight, and are there some opportunities for us to influence zoning ordinances within the local community to ensure that our community is able to live a healthy style. So now that we all know, all of the policy recommendations that came up, these broad areas of policy change that came up during our past meetings. Now we want to talk a little bit about what a community action plan is, just to kind of give you a sense of, ultimately where we're going. So a community action plan is really just something that's on paper that gives us a roadmap for how we get to the goal that we've identified for our coalition work. So the community action plan really is just a plan of activities that we're going to implement to mobilize the community, as well as address a specific need or 2 needs that will be identified through the policy scan, which we'll talk about in a few moments. The community action plan is really designed to do 4 things. Number 1 is designed to raise awareness. So anyone who's looking at this community action plan should be able to understand why the issues that we selected as issues are in the action plan, especially if they weren't already aware of the issues. So it's designed to raise awareness, but it's also designed to identify some solutions that collectively we can all help to achieve. So, this isn't something where the coalition members individually or as part of the organizations that they represent, it's not something where they are solely responsible for achieving whatever we list in the community action plan as next steps, or some of those intermediate steps that will help us get to our end goal. But really, it's an opportunity for all of us collectively to say, how can we address this problem from a holistic perspective, and how do we engage all of the right stakeholders so that no one organization is solely responsible for doing any of this work. The community action plan is also designed to shape next steps, and so those next steps could be next steps in the process of getting to the outcome of the community action plan, or it could be next steps in achieving a bigger goal, a broader goal, whereas the work that we're doing fills a gap but doesn't necessarily solve the problem in its entirety, and that's okay. The goal is for us to be doing that 4th thing, initiating action to effectively address the identified issues. And so this action plan really provides, again, that roadmap, so people, no matter what organization they're in, no matter where they are, they can feel connected to the issue, and they can get on board and help us address what that issue is that we identified. With the community action plan, there are a couple of things that we have to make sure that we include. Number one, we have to include objectives. So those are the things that, are going to be the goals and what's going to happen at the end of this project. We want to make sure that those objectives are SMART. And so the SMART stands for specific, measurable, achievable, realistic, and time-phased. So when we think about the first, the first four letters in that, really we want to make sure, is it something that we can do? Is it something that we're able to do given the climate that we're in right now? Is it specific enough that I can say, I know exactly what it is that is expected of me or my organization or a collective group of organizations throughout the city? And are we able to measure it? Is it something that we can say, I know that we did this at the end of the day? We can actually measure it. The time phase piece is that, it's not realistic to expect that an ordinance is going to change overnight or even, be adopted overnight. And so there are some steps that have to take place before we're able to get to the point of achieving our goal. And so we just have to make sure that within our community action plan, we're addressing the fact that there are these steps that we have to take in order to get to that end goal. Secondly, our community action plan has to include activities that will help us reach the objective, and we kind of talked about that within the first bullet. And then thirdly, we need to make sure that we're including all individuals and all organizations that will support our effort. We have to make sure that we have stakeholders either at the table or not at the table, but still willing to be engaged in this effort and help us get to where it is that we want to go. We want to make sure this is a plan that people, no matter where they are, can adopt and they can see the value in what we're doing. So that's the end goal. The end goal is for us to develop this community action plan and get buy-in on this community action plan. But there are a number of things that we have to do in order before we can get to that community action plan. So we'll talk about some of those steps now. The first step in the process is the determination of the policy focus area. And so that is, we truly are at this point in the process. We've had a couple of meetings where we've talked about, well, if you could change something that would improve the health of our community, and we could tackle that issue from a policy change perspective or a systems change perspective, what would it be? And so the 7 areas that we talked about at the very beginning of the presentation were the 7 policy focus areas that this coalition has been talking about so far. The next step is for us to identify important indicators related to the selected policy. So for example, there may be a piece of data that lets us know that we're doing a good job. Maybe, we want to reduce traffic on a particular road. And so maybe our indicator is the use of the level of service indicators typically used by transportation planners. And so maybe we want to, reduce that, but also increase. And a reduction in that shows that we're increasing maybe people commuting to work by a different mode. Maybe they're bicycling to work more, maybe they're walking to work more. And so that's just one indicator for one potential policy focus area. But there are a number of different indicators that we could use, and we'll talk a little bit more about those indicators as we go through the rest of the presentation, because I'll provide for you a real life example that we can focus our attention on. The next step, the third step in the process, is for us to identify stakeholders who will receive this policy scan tool. So think of this policy scan tool as a survey. And basically through this survey, we're going to ask specific stakeholders, whether they have a particular policy in place, a particular practice in place, if they're doing something that's evidence-based within their organization, and then we want them to tell us about it. So those stakeholders could be any number of groups or individuals, but as we go through the, determining our policy focus area and identifying maybe some indicators that are important, we'll start identifying some key folks that should be at the table if they aren't already at the table, or really just some stakeholders that maybe need to receive this survey from us. So the next question is, the next step in the process is for us to develop questions to assess whether policies, practices, and procedures exist. So, once we identify the stakeholders, who's going to receive this survey, now we need to develop some questions to ask them. And so we'll go through that question development phase, and then once we're all pretty certain that our tool is what we want it to be, then we'll share that survey with the selected stakeholders. Once we get that data back, we move to the sixth step in the process, which is evaluating the results. And now that we have some data in hand, and usually this data is information that you can't find anywhere else. So for example, maybe when we ask this policy question, we may ask it to a school superintendent, and we're asking the school district superintendent to tell us, what the schools in their district do in terms of a policy, a practice, or a procedure. Typically, this information isn't available anywhere else, and so this survey, this policy scan tool, allows us access to some data that isn't otherwise available. But now that we have this data, we can hone in on something more specific that should be the focus of our coalition efforts. So let's say if we are talking about the superintendent example, let's say we want to know if the school has a policy in place or a practice in place where they source locally grown produce, and maybe what that looks like within each of the schools within the district. Well, currently there isn't really a tool out there that gets that information from the school district at the school level. So this is an opportunity for us to get this data, and maybe when we get this data, it tells us that 80% of the schools in the school district do not use locally grown produce within the cafeteria environment. And so that may jump out to the coalition as an area that we need to focus attention on. And so that's what the coalition uses as the basis for the community action plan. Once the community action plan is drafted, we'll send that plan back out to all of those folks who initially received the survey, and we'll get their feedback. And based on their feedback, we'll edit the plan, and then we will all work to implement the plan. So some of these steps are, the steps can be maybe rearranged just a little bit, just based and that change might be based on the topic, the policy focus area that we select, or some other, knowledge that we've learned over the course of this process. But generally, these are the 9 steps in the process. So I talked a little bit about the policy scan, and again, it really is a survey so that we can evaluate how different organizations, whether that's an agency, whether that's a school district, whether that's a community-based organization, a school district, a municipality, but really evaluating those laws, ordinances, regulations, or policies within those organizations that are designed to guide or influence the people in those buildings or within that organizational structure. So this could be, really at the municipal level, we're thinking about ordinances. We're thinking about other laws that a municipality might pass. At an organizational level, let's say if we're talking about a workplace, we're talking about workplace policies. If we're talking about a school district, we're talking about school policies. If we're looking at community-based organizations, we may be looking at written policies, but also practices. Maybe, after-school feeding programs. What are the things that those after-school feeding programs do or don't do that could maybe help our young people be healthier? So we're looking at all of those policies and practices and procedures that organizations usually put in place to help improve outcomes among the individuals that they're responsible for. And not only does the policy scan help us when we go through the development of the community action plan, but the results from the policy scan really do provide stakeholders with information that in a way that they have maybe never considered it before. So the policy scan definitely provides some insight into some interventions that these organizations could potentially take on in order to improve the health or well-being of the folks within their organization or the residents of their municipality. But it also, helps them see the gaps that exist. Sometimes we just kind of look at things on the surface. We might have a piece of data that we use as we go throughout our work, and we don't necessarily look under the surface at maybe some of those things that influence behaviors, particularly health behaviors. And so the policy scan really helps us to really get under the surface of some maybe bigger issues and see and help organizations see how they can make changes, whether that's on a policy level, a systems level, or an environmental level. There are a number of organizations. I've talked about quite a few of them. I've talked about work sites and schools particularly. I've talked about communities. But there are a number of other organizations that we should be considering. So those could be institutions of higher education, not just public schools. We could look at colleges as well. We should think about daycare centers and youth serving organizations. With that, we could also focus on elder serving organizations. We could focus on hospitals and primary care practices and other healthcare organizations. We can also look at faith-based institutions. So with this policy scanning process that we're engaging in, we are not limited to just municipalities. We're not just limited to the school districts. We're not just limited to work sites. But if there are areas where it makes more sense because we can impact more people in order to bring about changes, particularly in health behavior and health outcomes, in some of the larger organizations, sure, we should do that and we can do that, but we shouldn't necessarily limit our thinking to just those kinds of organizations. So what I wanted to do was make sure that I gave you a practical example of how you can take the policy scan information and translate it into a community action plan for a local area. So as most of you all know, I transferred to the Birmingham area from Lancaster County, Pennsylvania. It's one of 67 counties in Pennsylvania. And Lancaster County was fortunate enough to receive some funding from the Centers for Disease Control and Prevention a few years ago to implement a community transformation grant program. And so one of the first things that the organization had to do was to conduct a policy scan. One of the great things about the CTG program was that the CDC had already identified 5 key areas where the community had to address, and so tobacco use was one of those areas that Lancaster County had to address through their policy scan. And so what the organization did was partnered with the local university to develop a web-based survey that was distributed to 4 sectors within the community, and those 4: employers, physicians, or physician group practices, school superintendents, and municipal officials. The reason why the coalition decided on these 4 sectors was because they felt like these 4 sectors connected with the majority of different types of folks within the county, and so they also focused on these 4 groups because these individuals impacted the most people within the county. So in terms of the employers, they focused their attention to the top 100 employers in the county, only the top 100 employers, and that was just based on sheer numbers of employees, where employers could really have a huge impact on a larger number of individuals. They focused on the top 6 physician group practices in the county because they knew that the top 6 physician group practices in the county saw over 70% of the county's population. And so that was important because they knew that they would be impacting a larger number of people within the county. They focused on the school superintendents of the public school districts within the county, so they knew exactly how many young people could potentially be impacted, and they focused on the municipal officials. There are 60 municipalities within Lancaster County, and so they targeted their efforts to those municipalities that were that had the higher populations. But the survey was sent out to all of the municipal officials because it was important for them to know what each of the municipalities were doing, in this case as it related to tobacco prevention. So here are some of the questions that were asked of the workplaces, the top 100 workplaces in the county. And so the workplaces got the survey, and in the tobacco section, they were able to answer yes or no to these questions. The physician group practices were also able to answer questions, and as it related to tobacco, remember one of the key terms I mentioned earlier was evidence-based practices. And so the questions that were asked of the physicians followed the 5 A's, which is a standard in terms of a recommendation for physicians in assessing whether their patients use tobacco products, and if so, how to help the patients get to a point where they're quitting tobacco. So this is another one of those evidence-based approaches. The 5 A's is recommended for all physicians to use. And so it was important for the coalition to know whether the physicians in the county were actually following this recommended practice. And so the data that they gathered helped them to determine that. These are additional questions that were asked of the physicians. It was also important for them to know whether the physician group practice banned tobacco on the facility grounds, and fortunately the vast majority of them did. The schools also received a survey that asked tobacco questions, and so the schools were asked whether they had a tobacco-free policy, did they refer students to cessation programs when they got caught smoking, that kind of thing. And then the municipalities were also surveyed, and so all 60 municipalities were asked these questions. Do they have written policies prohibiting tobacco use? That's an evidence-based practice. Following that is something more specific, a tobacco-free parks and playgrounds program, or as it is called in Pennsylvania and in many other states, Young Lungs at Play. And so as you can see, the vast majority of municipalities had some type of tobacco prohibition in place, but in terms of really focusing their signage and tobacco prohibition efforts on parks and playgrounds within the municipality, almost 3/4 of them did not have such an initiative. And so that ended up being what was important to this coalition, especially considering that despite the fact that adult tobacco use among adults in the county was low at 13%, tobacco use among youth was high at 44%. There were surveys that had been done that showed that, K through 12 students, 44% of them had reported that they had used tobacco products. And so they felt like this was a significant issue that needed to be addressed. And so Young Lungs at Play was the initiative that they decided to focus their attention on. So this is the community action plan example using tobacco use among youth. And so we'll go through each of these sections that you'll also see in your community action plan that was part of your binder that we shared with you, so that you can kind of see a practical example and understand, when we get to the point of developing our own community action plan, what we can expect to enter in each one of those fields. So the focus area for this group was to reduce tobacco use among the youth in the county. And some of these things may be oversimplified, but it will give you an understanding of how we got to what the community action plan. So the specific changes that that the group decided that the coalition decided that they were going to do was target 5 municipalities, and work with those municipalities to adopt a Young Lungs at Play policy. So we want 5 municipalities at a minimum to adopt a Young Lungs at Play policy and reduce youth tobacco use by 10%. that's specific, that's measurable. And so then if we go to the next step, who is going to do that? Or, who's going to make this change? And so this group decided that they wanted to get 5 of the top 10 largest municipalities in the county to adopt the policy. They wanted them to adopt the policy by June 2016. And so now that we know exactly what we want to do, what our initiative is, what our intervention is, what's the deadline for us getting this done, and who's the target, now we can go to the section where we talk about resources, barriers, and how to overcome those barriers. So some of the resources that they had at their disposal were the state health department's tobacco control division's resources, which included, an honor roll where the municipalities who signed on got placed on this honor roll. They got free signs that were provided to them by the health department. If there was a press event happening, then the health department made sure that the Secretary of Health or one of the deputy secretaries of health was available to come out to the press event. And then the press office within the health department helped create language for press releases that went out and helped to share information in the media so that the municipalities, were able to have that spotlight shined upon them for doing something so meaningful within their local communities. Also, the Tobacco Free Coalition of Lancaster County was able to contribute staff in order to, divide and conquer those 10 municipalities, which they did in partnership with the YWCA of Lancaster County. And then also the Community Transformation Grant Program was able to provide some staff as well as provide funding for things that weren't covered either by the health department or the Tobacco Free Coalition or the YWCA. So one of the needed resources was, they needed municipalities who were willing to participate in the effort. And so some of the barriers, when we think about that as a needed resource, were lack of buy-in among the municipal staff, and then also how do you communicate this new policy, which could be controversial, to your community members. And so in overcoming potential barriers, the thinking is that number one, there is necessary for us to obtain the buy-in of the mayor as well as the town council or the city council. So in addition to the coalition, the Tobacco Free Coalition, the YWCA, and the Community Transformation Grant staff all, going out and meeting with mayors and city councilors and council presidents, they recognized that it was necessary in order to get that buy-in. And so in addition to getting that buy-in, or as a part of getting that buy-in, the staff of those 3 organizations also made sure that they were providing all of the resources to the municipalities so that it wouldn't be, they would have less reason to join in the effort. And so pretty much everything that the municipality needed in terms of things, to make it happen, we made it happen. One of the things that we really couldn't do for the municipality was provide funding for the public works staff typically to go out and hang the signs, but pretty much we made sure that the signs got to the municipality. We made sure that all of the paperwork that needed to be done was submitted to the State Department of Health to get them on the honor roll. And then I think more importantly, we made sure that we had a press conference every time a municipality adopted the policy, just to show that it was important to these municipalities. It also showed that it was, it also helped us communicate the new policy to community members so that they would understand when they went to their parks and they saw these new signs, or if someone confronted them about the fact that they were smoking or using tobacco products within the park, they now understood that this was a new policy within their municipality. And so as part of your binders, you all have received this action plan framework document. And so this is pretty much what we will be using over the course of the next couple of meetings to develop this community action plan for whatever the 1 or 2 issues or 2 issues that you decide that we should tackle as a coalition. So some other considerations that we've talked about most of these, but making sure that we have the right stakeholders, making sure that that there is a perceived need to address these issues among those stakeholders, and that those stakeholders are willing to help us with this, because this is not something that we can do on our own. We really do need to have the buy-in and help of all of these other groups around us. Also, we need to make sure that we're not doing anything that's in conflict with something that's already going on or in competition. We need to make sure that we're filling a gap, not necessarily duplicating efforts. And we also need to make sure when we're selecting a policy focus that we have the time necessary to accomplish the goal. So we want to make sure it's a project that's doable, it's realistic within the next 3 years. So keep in mind that between coalition meetings, you're more than welcome to reach out to our office. Let us know if you have any questions or if you have any concerns. We'll be more than happy to answer those for you. We'll also do our best to get you connected to other stakeholders, or whenever there are things that come across our desk or email that we think that you should be connected to, we'll make sure we get that information to you. Or if it's just information that we think is good for our coalition members to have, then we'll make sure that we provide that. If you need to get in contact with the Birmingham office of the Gulf States Health Policy Center, you're more welcome to reach out to me. My contact information is provided on your screen, and I'm more than happy to answer your questions by phone or by email. Thank you so much for your time today. We hope this was beneficial to you, and we'll see you at our next coalition meeting.